Глубоко уважаемый профессор Морозов и профессор Савас, глубоко уважаемые участники Конгресса, я представляю нашу маленькую страну Кыргызстан, являюсь президентом Кыргызской психиатрической ассоциации и заведующей кафедрой психиатрии, психотерапии и наркологии Кыргызской государственной медицинской академии.
Dear professors, dear colleagues, my name is Tatiana Galaka, and I'm the president of Kyrgyz National Society of Psychiatrists. I'm also the chair of the Department of Psychiatry, Psychotherapy and Addiction of the Kyrgyz State Medical Academy. I am the representative of one of the smallest republics, Republic Kazakhstan.
Разрешите поблагодарить организаторов конференции за столь прекрасную организацию Конгресса, гостеприимства и передать привет от всех наших врачей, психиатров, наркологов, психотерапевтов нашей маленькой страны.
Let me express my gratitude to Turkish colleagues for the invitation and for the opportunity to present the information on my report here.
В моем докладе будут изложены кратко результаты исследования, в котором будут освещены две такие достаточно актуальные проблемы. Это проблема нерационального использования антипсихотиков и проблема синдрома эмоционального выгорания врачей-психиатров. Причем эти проблемы будут изложены во взаимосвязи, во взаимовлиянии. То есть насколько синдром эмоционального выгорания влияет на использование психотропных препаратов, в частности антипсихотиков.
In my presentation, I will talk about two main topics: the rational use of antipsychotic drugs, and another main topic is the issues of emotional burnout syndrome in psychiatrists of the Republic of Kyrgyzstan. By the way, I will tell you about the relationships between the irrational use of antipsychotic drugs and the development of emotional burnout syndrome in psychiatrists.
Я благодарю доктора Дарью Смирнову за помощь в презентации доклада. И если будут вопросы, я с удовольствием на них отвечу. Спасибо.
Professor Galaka is ready to answer the questions regarding her presentations. So in this presentation, Professor Galaka will summarize the result of her study on the topic of the rational use of antipsychotic drugs as one of the issues of emotional burnout syndrome development. One of the most important issues of the optimal use of financial resources aimed to improve the functioning of the mental health system is the rational use of pharmaceutical drugs. The problem of the adequate use of pharmaceutical drugs is of particular interest for the mental health service of the Kyrgyz Republic when the budgetary funding is still inadequate. However, the inefficient and outdated health aids are still in use. This problem results in an increase of the number of patients resistant to treatment and consequently in an increase of readmissions to the hospital, disability problems, deterioration in the quality of patients' life. An important factor that influences the effectiveness of the treatment of patients with mental disorders is a professional deformation of doctors, in particular the emotional burnout syndrome. The aim of the study was to evaluate a relationship between the irrational use of antipsychotic drugs in patients with schizophrenia-related disorders and the emotional burnout syndrome in the psychiatrists of the Kyrgyz Republic. The following tasks were identified regarding the study. The first one was to reveal the emotional burnout syndrome and the correlation between the intensity of its phases and the age and the length of work among the psychiatrists of the specialized hospitals, psychiatric hospitals in the Kyrgyz Republic. The second one was to determine the efficiency of using antipsychotic drugs procured under the budgetary funding in patients having schizophrenia-related disorders at the specialized medical institutions of the Kyrgyz Republic. And the third one was to identify the correlation between the emotional burnout syndrome and its phases and the irrational use of the antipsychotic drugs. A large block of the research was devoted to the study of the emotional burnout syndrome among the psychiatrists working in the psychiatric hospitals of the country, of the Republic. The study involved 76 doctors, including 36 psychiatrists working at the Republican Center of Mental Health, 16 psychiatrists from the regional centers of mental health in Osh Oblast and Jalalabad Oblast, and 24 psychiatrists from the 2 Republican psychiatric hospitals. The study of the emotional burnout syndrome was carried out using the methods developed by Boyka, which allowed accessing the formation of the emotional burnout syndrome in accordance with the stages of the general adaptation syndrome: the stress, the resistance, and the exhaustion. And now we'll move to the results of the study. The signs of emotional burnout syndrome have been identified among half of psychiatrists, 50% of psychiatrists. At these slides, you can see that the most severe phase of the emotional burnout syndrome among the staff of all of the hospitals was the resistance phase, followed by the phase of exhaustion, except for the respondents working at Republican Center of Mental Health, where the resistant phase was followed by the phase of stress. It should be noted that there are a lot of early career psychiatrists under the age of 40 with a brief experience, short experience of work, working at Republican Center of Mental Health, on the contrary, in contrast to the other hospitals. A correlation analysis, statistic analysis, has revealed the dependence of the emotional burnout syndrome phases on the age and the length of work among psychiatrists of the specialized psychiatric hospitals in the Kyrgyz Republic. The formation of the phase of exhaustion has been found among a lot of psychiatrists at the age of 40, which is of particular concern, as logically the phase of exhaustion is more common for the elderly professionals. The data presented on the graph demonstrate a decrease in manifestation of emotional burnout syndrome among the psychiatrists of 53 years age in the Republican Psychiatric Hospital, number 1, and the Republic Psychiatric Hospital number 2, over 61 years. Both psychiatric hospitals have elderly cohort of doctors, which is less tend to the formation of emotional burnout syndrome due to the certain moral and ethical values, as well as remoteness from the capital of the Republic, and accordingly lower workloads and fewer forms of control, monitoring from the administration. The low level of the emotional burnout syndrome intensity over 50 years of age is also reported among the doctors of both regional hospitals. At the Republican Center of Mental Health, the regressigram line, you can see at the slide, lies within the zone of the emotional burnout syndrome presence. The specialists of this hospital, including young doctors, are much more inclined the formation of emotional burnout syndrome. We can put it down to the insufficient number of staff on the main in this main psychiatric hospital, on the factor of low salaries, as well as constant control and monitoring and even pressure by the administrative authorities and resources and non-governmental agencies, and lack of legal protection of psychiatrists. According to the data presented in this figure, there is a decrease in the intensity of the emotional burnout syndrome manifestations among the doctors of the regional hospitals after 22 years of work experience. The results obtained from these hospitals arise from a small number of patients, a rare occurrence of severe cases of mental disorders, as well as from the fact that the hospitals have the staff that previously worked in different specialties, having short-time psychiatric experience, and involvement into psychiatry service after their retraining. The diagram demonstrates the correlation between the emotional burnout intensity and the length of work, which is similar to the diagram showing the correlation between the emotional burnout syndrome intensity and the age only at a Republican Center of Mental Health. In contrast to the regional psychiatric hospital, the staff of Republican Center of Mental Health has a sufficient number of staff, and the doctors of middle age and especially elderly age try to improve their skills in order to hold down the employment because of the gradual reduction in the number of beds. In addition, the doctor's salary depends on their qualification, which is also a kind of motivation for self-education of specialists of this age category. The young psychiatrists, on the contrary, are not afraid to lose their job, their employment, in comparison to the doctors of the post-Soviet period, who have absolutely different views on the professional activities. In particular, they believe that responsible, hard, and sometimes insecure work should be encouraged, appreciated, and physicians should be protected legally. And since this is often the motivation of workaholism is low. At this slide you can see the relationships between the intensity of emotional burnout syndrome and length of work are different for each phase of emotional burnout syndrome. It has been found that with the increase in the length of work, the manifestations of the phase of stress and the phase of resistance decreased. The specificity of dependence of emotional burnout syndrome phases on the length of work of physicians or psychiatrists of different specialized psychiatric hospitals has also been identified. An analysis of the annual reports, documents, and consumption of antipsychotic drugs, as well as the budgetary funds spent to procure these drugs, revealed an inadequate level of admission of these drugs to the patient and their irrational use. Unfortunately, only the following budgetary drugs that are used for the treatment of the patients with the diagnosis of the schizophrenia spectrum disorders, such as clozapine, chlorpromazine, haloperidol, trifluoperazine, and tioridazine, were available in the psychiatric hospitals during the study. The most often used drug in the psychiatric hospitals of the Republic of Kyrgyzstan is haloperidol. An analysis of financial costs for the procurement of antipsychotic drugs has confirmed that the most consumable drug is haloperidol, which is cheaper but has more side effects, including delayed action. Given the costs of 3-hexyphenidil, without which haloperidol is not generally used in the therapeutic doses, the amount of expenses increased almost 1.5 times. It has been shown that due to the procurement of atypical antipsychotic drugs, the costs of haloperidol and neuroleptic correctors, anticholinergics, increased, which demonstrates the evidence of irrationality of budgetary procurement of antipsychotic drugs. It is quite possible that the budgetary funds have been reallocated for the procurement of modern atypical antipsychotics. In most cases, there was an unjustified complex prescription of antipsychotic drugs. The doses of antipsychotic drugs were lower than the doses recommended by the standardized clinical guidelines. The elderly psychiatrists traditionally continue using chlorpromazine for a course of treatment, although there is a possibility to choose other drugs with greater efficacy and fewer side effects. The correlations have allowed accessing the consumption of antipsychotic drugs depending on the intensity of a particular phase of emotional burnout syndrome. The regressograms you saw demonstrated the direct relationship between the use of underdoses of classical antipsychotic drugs and the intensity of the phase of stress. A direct relationship between the use of therapeutically ineffective underdoses of drugs such as clozapine, haloperidol, chlorpromazine, and the increase in intensity of phase of emotional burnout syndrome has been revealed. It can be assumed that the burnt out, so-called psychiatrists, tend to avoid responsibility for the patient using inadequate doses of drugs. This tendency leads to inefficacious treatment and contributes to the process of stigmatization and psychotropic drugs and psychiatrists. The results give an evidence of the presence of an acute problem of professional deformation among the psychiatrists of the Kyrgyz Republic and the need to develop the programs for prevention and of burnout syndrome. So, to resume the findings, the signs of emotional burnout syndrome in the Kyrgyz Republic occur among 50% of psychiatrists working in psychiatric hospitals, and 24% of psychiatrists have the completed emotional burnout syndrome. There is a dependence of the intensity of emotional burnout syndrome phases on the age and length of work of psychiatrists in all of the specialized psychiatric hospitals of the Kyrgyz Republic. The inadequate budgetary provision of the psychiatric hospitals in the Kyrgyz Republic with antipsychotic drugs combined the use of psychotropic drugs and predominant use of typical antipsychotic drugs result the irrational use of antipsychotic drugs. Emotional burnout syndrome is one of the factors of the irrational use of antipsychotic drugs by psychiatrists of the Kyrgyz Republic. The more intensive the manifestation of emotional burnout syndrome are, the less adequate the choice and the doses of antipsychotic drugs became. Thus, the research has not only identified the acute problem of irrational use of antipsychotic drugs in the specialized psychiatric hospitals of the Kyrgyz Republic, but it has also scientifically proved the dependence of the treatment failure on emotional burnout syndrome development among the psychiatrists of the Kyrgyz Republic. So thank you for your attention.
Спасибо.